So our speech is about dissociative identity disorder, which is a mental illness. A mental illness refers to a wide range of mental health conditions that affect your mood, thinking, and behavior. I'll start talking about several causes of this mental illness. Dissociative identity disorder is considered a psychological condition that is caused by different factors such as trauma experiences as a child and extreme neglect or emotional abuse. Now I'll talk about the several signs and symptoms. The Diagnostic of Statistical Manual of Mental Disorder has defined the symptoms of dissociative disorder as first, two or more personalities in one person, gaps in memories of important or everyday information, and third, they can have physical symptoms without cause, such as major depression, suicide attempts, and stress disorder, and they can also develop different physical conditions, such as one personality can be blind and the other one cannot.
In order to make a diagnosis for dissociative identity disorder, time is needed. It is estimated that people with dissociative disorders spend, on average, 7 years in the mental health system before receiving an accurate diagnosis. This is common because the list of symptoms that cause a person with dissociative disorder to seek treatment is very similar to those of many other psychiatric diagnoses. Sometimes patients can experience not only DID, but also other mental illness like depression or anxiety. Presenting two or more mental illness can extend this time even more. There is no cure for dissociative identity disorder. However, there are several long-term treatments to try and control this mental health issue, but only if the patient stays committed. Effective treatment includes talk therapy or psychotherapy, hypnotherapy, and adjunctive therapies such as art or movement therapy. There are no established medication treatments for dissociative identity disorder, making psychologically based approaches the mainstream of therapy.
There are different types of dissociative disorders. One of them is dissociative amnesia. This consists in that you can recall information about yourself, your life, events, and people you have met. Another is dissociative identity disorder. It is characterized like the presence of individuals inside a single person. These individuals can be felt like people living inside of you or talking inside your head. Another type of dissociative disorder is depersonalization-derealization disorder, which consists in a feeling of detachment or feeling outside your body, in which you can watch everything as you were like in a movie. You can watch your thoughts, feelings, etc. After analyzing all of the characteristics that involve a dissociative disorder, we concluded that dissociative identity disorder is a disease which is extremely complex and works in a very strange way. It is important to recognize the symptoms and signals in time before the disorder develops so that it can be controlled in time and it doesn't progress. Thank you.